Well, I have been injecting at Empty Beauty Lab for about 3 years, and before that, I spent a year, 2 years just doing Botox. So I was injecting for 5 years, I guess, but started adding in all the different things when I started at plastic surgery. I worked in derm before I went to PA school, so I saw that whole world. We did both medical and cosmetic derm, so I was always interested in it. And then did a couple of rotations in derm and kind of in PA school and was leaning towards the aesthetic route of that. I went to Pacific University. I'm from Oregon. I went to all my school in Oregon, so I haven't traveled far. We're doing at least 2 different jobs. Yeah, doing the injecting is one, which is on the MDBL side, and then operating and surgery, which is the Portland plastic surgery side. And then I'll sometimes see some post-op patients. If there's like a issue going on with surgery, then I can pop over and see them. But a lot of operating. And then I run the weight loss program. So I actually had been prescribing GLP-1s like back in family medicine. So for diabetes, before we knew they caused weight loss. And so I was like, oh, yeah, I love these meds. They work super well for blood sugar and patients do really well on them. And I was like, yeah, and my patients lost weight, but I wasn't, intending them to lose weight at the time. So I was like, yeah, these meds are great. And then when we were at a conference, I started realizing that, oh, we're in the realm of we are able to prescribe them for our patients here. And it actually was because when you want plastic surgery, sometimes you need to hit a weight goal before you have surgery. So we used to just be like, oh, you want a tummy tuck, but it's safer and better aesthetically if you lose 20 pounds before. And so we'd say, okay, bye, see ya, go lose your weight, come back. And now we're like, hey, we can help you get there. So that was kind of why we brought it on, was just kind of for our patients that were in the group already that were hoping to have surgery. It typically, when you have these like trendy medications, it comes out a little bit later that, oh, they're so bad for all of these different things. But it's interesting that it's kind of the opposite with these meds. Like, oh, it's so popular and trendy. What's going to happen? And then they're like, oh, it's good for this. It's good for this. It's good for this. Oh, and this is how it helps your health too. So it's kind of, yeah, that's fun. Patients are so happy. People just feel a lot more confident, which is kind of what we're all about. And plastic surgery and MDPL is like bringing confidence. It really does go hand in hand to, if people are feeling better and how they look, then great. I mean, it's hard to track just weight, because I feel like what is weight? It's really about like body composition and how clothes are fitting and how you're feeling. And sometimes people just, yeah, I mean, the number on the scale it's hard because sometimes we do have to track that with these kinds of medications, but it's so much more than the number on the scale. And I tell patients too, it's not like it's this magic drug, it's a tool. So if you're not putting in the work, it's not working. I think a lot of the things out there that people talk about with the GLP-1s is that, oh, you're just like taking a shot and then you lose all the weight, but it's helping you. You have to be exercising. You have to be eating well. It just kind of gets you more in tune with your body and helps you to follow that. So yeah, I think it's a helpful tool for a lot of people. I mean, you have to really be on it of monitoring what you're eating so that you're hitting those protein goals and actually getting enough, which, is true of like really strict diets too, is like if your caloric restriction is too intense, then your body's like, oh, I want to hold on to all of this. And then it makes it even harder to lose weight. Or if you're losing weight too rapidly and not eating, then you're risking muscle loss, which is actually one of the bigger side effects, is losing muscle. So we talk a lot about like hitting protein goals, getting those weights going so that you can combat that. But if you do it safely and it's managed well, then it's a great medication for people. Surgery is kind of the other things that I do. Oh, I also do like procedures in the office, like removing moles or cysts or those kinds of things. But I'm not going to do your full skin exam. You still got to see a derm for that. But if you're like, oh, this is a mole that I want gone, you could definitely see me within a month, and you can see a dermatologist probably within 6 months to a year. If it's like, I want all of my moles checked and I have a history of skin cancer and I have to come in every couple of months to get this looked at, I'm not your girl. But if it's aesthetically, you don't like this spot, or you're like, I don't I just want it to send out to the lab. Like, this is a mole I'm worried about and I don't want to wait a year. I can definitely take it off and send it to a lab. I think that's what is cool about MDBL is that we are with a plastic surgery office. So we have that expertise. So yeah, I mean, is it pretty common that a patient will come in for Botox and then they're like, I don't really like this like spot right here. Can you just zap it off? And I'm like, actually, that looks like a spot that needs to be surgically removed. So we're going to schedule that for in the office procedure room. I'll take it off then. Or like, yeah, that's a little spot that I can just scrape off. But I don't think if you went to any med spa, would that be something that I would be comfortable with someone doing? So we're plastic surgery, so we can do that. I was debating whether I go into full-time derm or go into plastic surgery. I wanted to do the injectables as well. And then I was like, if I mainly like doing procedures, then you should probably be interested in surgery. And so I was like, let's go talk to them, see what we think. And then I came and met the team here and fell in love. And so I was like, okay, this is it. It was more of like a risk jumping into a totally different field, but it was really it's the surgeons that I met and Colleen, the other PA, but the surgeons that work here that I was like, yep, these are my people. I need to be here. I love new patients. It's so fun to go over the whole consult. So I love like patients that have never had any treatment ever too. It's so fun to like go through all of the different things, which sometimes can be overwhelming, but I try to make it as simple as possible. But yeah, we just pop into the room, sit down, and then typically I'll ask patients like what they're concerned with first or what brought them in. And usually obviously there's a reason they came in, whether it's just, oh, I'm looking older or, oh, I don't like these lines. Sometimes it's more specific and sometimes it's not. And then I like to go through your whole entire face. So you may have come in for your lips, but I'm like, well, while we're here, let's just talk about everything. And so I kind of just start from the top down and then see all of the things that I'm seeing, which, I see different things than what sometimes patients will notice. Or often it's, oh, I didn't know that was something you could fix. Or I didn't know that was something that is in the realm of injectables. So it's nice to kind of bring that attention. And I definitely don't consider myself a pushy person at all. So I just like to I like to educate. So I'm giving all of the options. I like to write it down on like a little pamphlet that we have, talk through what I recommend and then what the patient decides they are interested in too. And then we kind of just go together like, oh, I came in for this, but this sounds like a good idea instead. Or I want to do both. Or maybe down the road, that's something to think about is often a good one too. It's nice to know if patients are they're hoping to get treatment that day. But depending on what it is, I like to do something while you're there. If it's like a longer treatment, then we typically will schedule it out. But it's nice to know ahead of time too what you're getting into. Like, especially if you've never had anything done before, then we'll be like, okay, you're coming in a couple of days. This is what you're going to do the day of treatment. This is what to expect when you come in. And sometimes that gives people peace of mind to not have to do their treatment that day so they can get all ready for it. But if they want to, then we go for it. Patient leads the journey. Some things are multiple series treatments. So that's why the most amount of time you can allow before like something major is great. And if it's like, oh, yeah, I'm getting married in 2 years, we can wait. We can just start skincare and then, okay, this is what you're doing 3 months before we're getting lips done. This is what you're doing a month before we're getting your tox done. Yeah, you map out the journey.